Hello, my name is Arto Vuori and I work at the National Institute for Health and Welfare in Finland. I'm going to give you a brief overview on our national health and social care registers here at our institute. National registers of health and welfare are one of the various data types of THL. Register data has been gathered for the past 50 years. The data from registers can be combined with data from surveys, health examination studies, samples, and clinical data. Together, they form a significant knowledge base helping to follow the state of health and welfare in Finland. Registers of THL are mainly personal registers, meaning that data is collected on the individual level. Data is collected on those individuals who have received treatment or services in the Finnish healthcare and social care system. Many of the registers focus on some specific patient group, disease, service, or procedure. This kind of registers include the cancer register, orthopedic register, and medical birth register or child welfare register. The national care or discharge registers are different. The data comes from inpatient and outpatient secondary care and from public primary care nationwide. Care register data from social care is collected as well. The data is gathered for the purposes of statistics and scientific research only. The data is not used for making decisions at the level of an individual patient. The purpose is rather to serve national decision-making and high-quality scientific research by providing results on statistical level. Of course, there is always exception, which in this case in the registers that are formed as part of THL's own services. The biggest of these is the database for forensic examinations. In addition, THL has many statistical datasets where the unit of observation is a municipality or healthcare service provider. Well, how is the data compiled and how does the register data differ from survey data or health examination data? Register data is unique in good and bad in the sense that it is compiled from the real-world healthcare and social services. The diagnoses, dates, and procedure codes are coded by working professionals in the field, not researchers or study nurses. IT has for decades enabled gathering the most important core data into a national centralized database in a structured form. The data is collected from source IT systems of the health and social care providers and it is transferred to THL. For example, data from Avohilma, the National Primary Care Register, is transferred to a national database every single night while you are sleeping. Once it arrives at THL, the data is checked and it might be supplemented with data from other sources. These checks are mostly statistical and automated because volume of data is huge. At this point, we find out, for example, whether inpatient episodes from a certain ward are provided or not. The quality checks are crucially important. Experience has shown, however, that best understanding on data quality is gathered by using the data for rigorous research and asking concrete research questions for the data. It is actually research that provides the most valuable knowledge about the data quality and lack of. In order to utilize the data for deeper statistical analysis and scientific research, it is necessary to use individual level data. But this data is always either pseudonymous or anonymous. The process of making data pseudonymous means that all direct identifiers are removed from the data. The process of making data anonymous means that even indirect identifiers are removed from the data once and for all. Individual level pseudonymized data requires permission for access. The permit procedure is strict and requires valid scientific study protocol. Technical data security is taken care of in all phases. Descriptive statistical reports and statistical databases are open and available for you at the website of THL. Now, here you can see the 4 most used registers of THL in this slide. The most utilized being the National Care Register for Healthcare. It started as a hospital discharge register in the 1960s, but it now contains both inpatient and outpatient data from all public specialized care in Finland. As mentioned before, National Primary Care Register Avohilmo collects data in real time. These are the different ways for utilizing the register data. Register data is used for compiling official statistics, producing open databases for everyone to use, for pure register-based research, or the data can be linked to biobank samples, surveys, or health examination, or clinical data. The results from studies utilizing register data have been published in best peer-reviewed journals. Results have had an impact on the healthcare system and care practices. Here you can see just a few examples. Now, many of you now hopefully ask how to obtain this data and how to utilize it in your research. As said before, statistics and published results are free and open, and you can find them from our website. If your study requires individual level data, you can apply for research permission in order to access the data. The data science and analytics services of THL are always ready to help with analysis and reporting. In the near future, a single one-stop shop permission authority is going to be formed in Finland. It will authorize data permissions for registers of THL as well as several other government agencies and clinical datasets nationwide. The data gathered by THL could be valuable for your research. Don't hesitate to contact us if you became interested in finding out more.